Hi, my name is Michael Schutza. I've been a practicing insurance agent since 2007 in Louisiana. Healthcare has been the number one issue on a lot of people's minds. What will happen if the president gets a second term? What will happen if Joe Biden gets elected? What kind of effect will a Supreme Court justice have on this entire conversation? What I would like to do is provide a little bit of non-biased perspective about our current system, how the ACA really works, clear up some misinformation about the old system. And I'd like to have an honest discussion about creating a plan, a real way for our country to move forward, not leave anyone behind, but still allow us as Americans to make choices. There is so much information to cover. I'd like to break this down in several different sections. The first, problems and misconceptions with the old system and with the current system. So let's talk about the big elephant in the room. What's the price differences? How much have they been? How much have prices gone up? So the other day I was pulling archived records and I came across applications from back in 2010. One of the applications was a young couple that came to see me, mid-20s. He smoked. They wanted maternity. They wanted to start planning for a family. So we put him on to a $5,000 HSA. At the time, it was the best dollar versus liability. That plan was going to cost them, including maternity and smoking, $383 a month. What would that cost them today? I went online, went to a local quoting site, which almost anybody can find these days, and mid-20s with maternity, and he was a smoker for almost the same deductible, actually a lower deductible, $1,128 a month. That is insane. If $383 a month was unaffordable 10 years ago, how is $1,128 remotely affordable? Someone out there is going to say, well, there's a subsidy. Let's talk about that for just a second. So there's two people in the household. He's 27, she's 25, he smokes. And the household income is $65,000 a year. If you cut that down the middle, pretend that he makes $35,000 and she makes $30,000. It's not that much money. That couple would have received a subsidy of $152 a month. That means instead of costing them $1,128, their premium would be reduced to $976. Under the old system, under the old plan, they would only pay $383. And today, even with a subsidy, they would pay $976. That is not affordable health care. So let's look at a second example. I remember this one specifically because I had several conversations with her. Call her Mrs. Smith. Mrs. Smith came in to see me. She had just retired. She was 64 years old. And she needed health insurance until she got to Medicare age. And she was, she told me specifically, I don't care about doctors. I'm not taking any medication. I just want something, if I have to go to the hospital, that it doesn't bankrupt me. I said, yes, ma'am, Mrs. Smith, we can take care of you. She wanted to be able to go to whatever hospital she wanted to in our local area. In our local area, there's 3. So she didn't want to be locked into a network. So we put her on a PPO, something that would give her that flexibility. So, oh yeah, and by the way, she also smoked as well. Hospital only, including preventative, PPO, no doctors, so no primary care visits, and no medication. She didn't take anything. She didn't want to pay for that service. So we wrote her a policy. The premium came back $142 a month. That was affordable for her. She said, okay, I can do that. Why this case sticks out in my mind so much is because after the ACA went into effect, her plan that she bought did not meet minimum required standards. A politician came and said that her plan wasn't good enough, and so they forced her to change. They forced her to move up into a policy, something that covered doctors, covered prescriptions, things like that. If she walked into my office today, if a 64-year-old walked into my office today and said, I want a high deductible plan and I want to be able to go to a myriad of different hospitals, what could we do? This would be the plan. And instead of $142 a month, it's $1,677 a month. Now, we would probably have a conversation about is, well, let's just pick one hospital system to go to, a much, much, much smaller network, and the same deductible. That plan would go down to $1,005 a month. It's not affordable. It's barely even health care. And these were the options. Why I remember this particular client is because when she was forced to move up into the new plan, it wasn't $1,000 a month at that point. It was between $600 and $700. It was way higher than the $142 that she wanted to pay. And she cried. And it broke my heart because it was unaffordable for her. She was just trying to get to Medicare. She was trying to make her retirement stretch. And what they did to her took away her right to pick, took away her right to choose. And that's not right. It really upsets me when things like this happen. I promise myself that I will take care of these people. I want to make sure that they have enough information to make the best decision. And when my hands are cuffed, when the system works against the clients, it turns my stomach. So in this example, let's assume that she would qualify for a subsidy. So if she made $49,960, then she would get a $590 a month subsidy. That would take her plan from $1,600 a month down to $1,000. Or it would take her plan, if she picked the smaller network, from $1,000 a month down to what? $400? Which is still just over 3 times as expensive as if she had the plan that she originally wanted. I don't feel that the ACA was designed to artificially inflate prices. I think it was put together by people that didn't understand a lot of the mechanics. I think there was a lot of political influence that sounded good on paper, but it is undeniable that what has happened is there has been an artificial inflation of premium for no reason. Our old system was better prepared to handle things on a price basis. I think that needs to be acknowledged. Another issue with our current system, and I understand why this is built this way, but our old system didn't have these restrictions. Today, right now, unless you are in a special enrollment period, you cannot go out and buy an individual health insurance plan. You can't. You can't buy it in February. You can't buy it in July. You can't buy it on a Tuesday. The only time that you are eligible to pick up a plan is during the open enrollment period, during the end of the year. Our old system allowed you to buy whatever plan you wanted, whenever you wanted. You had the option of picking and choosing. Now, this brings me to my third point. Before the ACA, before the Obamacare plan kicked in, families used to come and they would say the wife would have health insurance through her employer. The husband didn't, and they had a young child. And the wife was able to get coverage through her work, but it was way too expensive for the husband to get on. They just didn't want to pay it. There was no need for it. They said, well, he doesn't ever go to the doctor anyway, or he doesn't take any medicine. Why would I want to pay an outrageous price to get on her working insurance? So what would happen is we would sit down and actually develop a custom plan for them. We would encourage the mom to stay on the employer plan because she's getting the employer 50% match. We would put together a high deductible plan, something for the husband, because if that's what he wants to buy, if he's only going to go to the hospital, if he cuts off his leg, then that should be his choice. Covers preventative, obviously. But the dollars saved on the husband plan, they would actually spend above and beyond on the child's plan because they want to make sure the pediatrician was included. They want to make sure they had good prescription coverage, and they wanted to have low controllable copays. That way, if they had to go a bunch for ear infections or the sniffles or whatever, that they could do that. So they could essentially build the plan the way they wanted to fit their individual family. Today, you can't do that. Today, if you have health insurance available to you through an employer, or through the VA, or through any other means, you can buy an individual policy, but you don't get the subsidy. You're not eligible for the subsidy. Another point, children can't own individual plans. The old system, I could make the child the contract owner because the parents wanted to pay for it because that's the one that they wanted for their kid. Today, you couldn't have an extra robust policy for your kid unless you were on it, unless you were paying that additional premium. What does that do? That eliminates choice. That causes an increased pricing for families. And that's not fair either. Do I think it was intentionally designed that way? No, but I think it's the outcome of how the system was put together, about ripples that happened when the ACA was instituted that no one really considered about what that would do to a family if you couldn't subdivide them into 3 different plans to fit their 3 different needs. So I'd like to come up on item number 4. There's a lot of politicians that are discussing, if you use your plan, they will take it away from you. You're going to lose your health insurance. It's garbage. As far as I'm aware, with every major medical policy, including before ACA was instituted, in every policy, there was a contractual clause called guaranteed renewability. What that means is all you have to do is pay your premium. If you pay your premium, they cannot cancel you because you use your policy. It can't happen. It's against the rules of the contract. It's against the law if that is listed in your policy. Guaranteed renewability means the policy is guaranteed to renew every single year as long as you pay the premium. So it irritates the ever-living fire out of me when politicians stand up on stage and say, oh, if you use your plan, they're going to take it away from you. I scream at the TV saying, this isn't car insurance. This isn't homeowners insurance. Just because you get into a wreck and you lose your coverage because you use it too much. That's not how health insurance works. So by them standing up there and drumming up fear over a contractual protection, it's wrong. I don't know whether they know that or not, but it's wrong. And that's how our old system works. They couldn't just cancel you for using your plan. Let's talk about increasing premium. It has been sold that insurance companies are just going to raise your premium if you use your plan. Similar to the car insurance or the homeowner's insurance. Oh, if you make a claim, your rates are going up, right? Specifically for you. Health insurance does not act like that's not the case. For one, at least in my state, and I'm sure this is probably the case in other states as well, any premium increases have to go through the Department of Insurance. They can't just raise your rates because they feel like it. Oh, she bought cold medicine. Oh, we're going to crank her up 400%. That's not the case at all. What happens is they put your contract into a pool with other people. In this pool, you can think of it like a block. A lot of random contracts are put together and they track that block. And if the claims for that block go up, well, then the premiums on average go up. If the claims for that block go down, the premium goes down. That's how they assess it. They don't just single out one person saying, oh, you had this much medicine, or oh, you had this procedure, or oh, you had this accident. It doesn't work like that. They won't single you out. And as far as I'm aware, it's illegal for them to single you out. They have to look at everyone as a whole, as a block of business. So the last section that I'd like to discuss here is the ACA and the federalization of the student loans. When Obamacare was first put up, he said it's not going to cost anything. It's net neutral, or whatever language that they use. Well, how could they say that when there are all these subsidies and all these different things coming in? And I wholeheartedly believe that the only way their math would balance is if they federalized the student loans, which they did, and they put the cost of the ACA on the backs of these college students just graduating, trying to get out and make a living for themselves. So what does all this mean? What does it mean for the country? How do we move forward? I just listed a whole lot of problems, but, what are you going to do about it, right? I can tell you this. If you leave the ACA in place, or even a Frankenstein version of what it's turning into by repealing certain parts, you're going to leave regulations in that don't need to be there. You're removing regulations or other things out, and it's going to deteriorate into a complete and utter mess. You cannot have a Frankenstein version of the law, period. It's never going to work. It's going to operate even less efficiently than it's doing now. 2 options are needed. 1, the entirety of the ACA needs to be repealed, completely gutted, root to stem, as they say. At the exact same time, a new plan needs to be put into place. Something that will still offer the protections that the American people want, but the flexibility that they deserve. What I would like to do now is to go over the 5 or 6 items, a plan that would be able to fix the system and be able to put our country on a path so that we can move forward and not have to worry about our health care. Number 1, first and foremost, the ACA must be removed completely. Number 2, if someone has an individual policy and is receiving a subsidy, allow that subsidy to remain for 12 months. It's not their fault the system's changing. If they're in the system now, allow them to stay. You remember the term that I put forth earlier? Guaranteed renewability. As long as the premium is being paid on current policies, those contracts will remain in force. The government should continue to pay the subsidy to help those premiums balance out until the new system is created. Number 3, transitions. I'm going to spend a few more minutes on this particular subject because I want to be extremely clear. This was a problem from our old system, and this is something that needs to be taken care of in our new system. So I'm going to paint a picture for you. You have someone that is retiring, quit their job, changed their job, but they had health insurance. They had it for years. They should not be penalized moving from the group system over to the individual system. Transferability. We should guarantee a protection that says that if you have continuous coverage for 12 months, you would be allowed to pick up new coverage on the individual platform, guaranteed, at a standard rate, not a preferred rate, not a select preferred rate, at a standard rate. I would also like to bring back underwriting. I know underwriting is a dirty word, so is pre-existing condition, right? Ugh, that means someone can tell me no. No, that's not what that means. What that means is that the insurance company can take an accurate look at what your health is and can base your premium upon that. We need to bring back underwriting to allow people to go through it. What if you're in your 20s? What if you're in your 30s? What if you're healthy? Why should you pay more because the insurance company has no clue about what your health conditions are? Allow people to put themselves out there to be underwritten, to get a preferred rate, a semi-preferred rate, a standard rate. This is where the subsidy would help. If you have someone that has a heart condition or has cancer or HIV, that's where we need the federal government. Don't subsidize policies for healthy people. Allow the health insurance companies to underwrite, and based upon the pre-existing conditions, the federal government should come in and help subsidize those extra pieces of premium. We actually used to do this already. It was called the state high-risk pool. Some states had this, some states did not. But essentially how it worked was someone would go through and they would get 2 or 3 applications to a health insurance company. Let's just take a horrible example, something that is going to give them a guaranteed decline, right? So let's just say HIV positive. You would go through and you'd pick 3 different carriers that you'd want to cover for your health insurance. They would all 3 decline you. You would then go to the state and say, hey, I got declined. What do I do next? The state would then randomly assign you to one of those 3 carriers, and the state would actually help you with this overage of premium. I believe that something like this could be set up on the federal level. So rather having subsidies based upon age, income, location, you actually have a subsidy based upon what your health is. This would allow everyone to have a health insurance policy if they wanted it, and you'd be subsidizing the health of people that really needed it, all while allowing your healthy folks to come in, go through the underwriting process, and pay less because they're healthy. So let me recap this idea. We need to set up a federal high-risk pool. We need to allow individual policies to medically underwrite. By doing so, the insurance companies will A, have a better idea about what their potential losses are going to be. B, if someone is uninsurable, then the federal government can step in and help subsidize those premiums to allow those people to be able to get coverage. While we're on the topic about a federal high-risk pool, let's talk about pregnancy, maternity coverage specifically. A lot of politicians out there are saying if you remove the ACA, then pregnancy will become a pre-existing condition. Sounds really horrible and really scary. That used to be the case beforehand. And if someone wanted to buy maternity coverage, they could. They weren't forced to. And that's something that I don't believe most people understand. As far as I'm aware, the law says that insurance companies are not able to discriminate or charge women more for maternity cover. I don't know of any insurance company that is going to go without premium. So what's the only direction insurance companies can go with? Instead of just charging maternity coverage for women, they charge maternity coverage for everyone. That means if you're a man, that means if you're a child, that means if you're an elderly woman not able to have children, that means if you don't want it, the premium is still allocated there. I looked up online and I want to say women between the ages of 18 and 50, there's like 60 million of them in the United States, roughly 20% of the total population. So my gut feeling tells me that it's not right for 100% of everyone that has health insurance to be forced to pay a premium for 20% of the population just to make it fair. So nothing I've said addresses the issue of pregnancy. How do we circumvent this? You could lump in pregnancy as a high-risk pool benefit. If someone wants to buy the policy with pregnancy, we could have half of that cost picked up by the feds. So on a maternity policy before the ACA started, maternity would run between $100 and $150 a month of extra premium, just ballpark numbers, right? So if you wanted pregnancy to be a covered pre-existing condition or something that is covered under a woman's policy, you would allow for a portion of that premium, the extra premium, to be absorbed by the federal government. I think that is a much better idea rather than forcing a 25-year-old man or a 64-year-old woman to pay for maternity on their policy, considering the statistical averages of them having children are less than zero. Now, moving on. This is not going to be a conversation that most people like, but this is going to be a conversation that needs to happen. Medicaid. We are doing our country a disservice by keeping people in the Medicaid system. For those of you that don't understand this, I'm going to give you an example. Let's talk about an ambulance ride for just a moment. And I'm going to make up some numbers, but I think for the most part, you will understand where I'm going. If you have no insurance and you want to go and ride in an ambulance due to an emergency, let's just say the retail price for that would be $1,000. If you have insurance, there's a negotiated rate. The price comes down a little bit to, let's just call it $750. And the person has to pay a little bit of that, like $200. If you're on Medicare, the rate is negotiated even lower. So the Medicare reimbursement rate for an ambulance ride, let's just pretend it's $500, while Medicaid is even less than that. In this instance, Medicaid may pay $300 for an ambulance ride. Now, why is this a horrible thing? States and federal government have to cover Medicaid expenses. Well, when you pay that little for medical services, no one takes it. The state has to take it. The state hospitals have to take it. The state pediatricians at the state hospital. You know, you're very, very, very limited on where you can go and what kind of services that you can get from the Medicaid system. I have nothing but respect for people that work in those conditions, for people that work at the state hospital, for people that see the people on the Medicaid rolls. But I'm telling you this, the people on the Medicaid rules are getting nothing but disservice because they don't have the freedom to go and see which doctors they want to, what hospitals they want to. They don't have the ability to pick and choose because only certain facilities and certain medical practitioners take Medicaid. And that's specifically because of how much the federal government or the states pays for the doctor rate or for the ambulance rate. The Medicaid reimbursement rate should be raised to whatever the Medicare reimbursement rate. That would go a long way, but that's still barely adequate. Now, there's a second demon to the Medicaid system, and it's black and white. You're either on Medicaid or you're off. There's no gradient, and a lot of it is based on income. Just to use an example, if someone makes $20,000 and is Medicaid eligible, they have full benefits. If they work 1 hour of overtime and they make $20,010 for that year, it's gone. That's it. They're completely off the system. That's not fair. That's not correct. We're supposed to be helping people, but you're penalizing them for if they earn more than what the system allows. Now, all of these numbers are based upon federal poverty levels and certain percentages and stuff, and I don't want to get into what exactly those percentages are. But what I would like to do is discuss a graduate system. Just take the current example, $20,000. If someone makes more than $20,000, say between 20 and 25, they would still be allowed to participate in Medicaid, but they would be required to pay a small premium back to the state. Well, then they get married, and let's say their income, the household income, jumps up between 25 to 35,000. Well, instead of being automatically removed from the Medicaid rolls as a family, well, you would pay a little bit more to the state to stay in the system. I still have health insurance, but I'm still able to get the coverage that I need. So you have a graduated system. The more someone makes, the more premium that would have to get paid back into the state to help cover them. Now, at an arbitrary federal poverty level, whatever percentage we want to talk about, 400% or whatever, let's just to use round numbers, let's just call it $45,000, right? So if a household makes $45,000, at that point, they would not be allowed to stay in the Medicaid system. But what you've done is you've taken someone in the system from 20,000 and given them a path to allow them to make more and more and more to where they can finally be financially set and financially stable. So them going and paying $200 or $300 or $400 for a health insurance plan isn't such a shock. You've allowed that transition. And remember, under the plan that I've laid out, if you've had Medicaid for 12 consecutive months and then your income finally picks up to that point and you want to go out and buy a health insurance plan, boom. You don't have to worry about it. You would be allowed into the individual system and not have to worry about, oh, would I even qualify? Because you've done what you were supposed to do. And then if they get a better job and they're able to get onto a group plan, they work there for however long, then when they come off, hey, I've maintained coverage. I go right back into the individual system. That was a lot. I'd like to recap. Our current system can't exist the way that it is. We can't allow a Frankenstein law with bits and pieces still active. We need to repeal the current ACA and replace it with a system that is not going to fail the people that are in it. We need to allow the current people on the individual plans with subsidies to maintain that coverage and maintain the subsidies for 12 months. We need to allow transitions between group plans, Medicaid plans, into the individual system, and vice versa, without having to prove insurability. We need to establish a federal high-risk pool to help subsidize high-risk individuals that are currently in the system, to make those dollars the most effective going to the people that need it the most. And lastly, we need to overhaul Medicaid, both increasing what the Medicaid allowable is for procedures to open up this entire country's medical system to them. And we also need to institute a graduated system to allow people to still participate in Medicaid, but pay for that service. And the more money that they make, the more they would be required to pay to give them a path out and away, rather than just cutting them off because they make $1 more than what they're supposed to. I don't have all the answers. I haven't asked all the questions. What I want to do is I want to begin a discussion to actually have a real plan put together, address real issues, and actually design something that our country can move forward with, rather than being polarized. Oh, well, we have to have these things done, or somebody's name is on it over here, so we can't touch it. That's not fair. That's not right. And that's not healthy. We need to fix the problem. We need to repeal the ACA. We need to put something in that works. And we need to do it all together as Americans. Thank you for taking your time and listening to this video. Please leave a comment. I would really like it for you to share this to congressmen, to senators, to people that would listen. And if you have any other ideas, you want to add them below, please feel free. Thank you.